All right, let's find you the right Medicare prescription drug plan for this next year, shall we? Open up a new window on your computer and we can do this together if you'd like. We're going straight over to Medicare.gov. This is what the site looks like today. They do change this regularly, so depending on when you watch this, it may look a little bit different with different pictures. The commotion and the marketing and everything that goes on during this Medicare annual election period causes a lot of confusion and fear. So if you're having feelings of anxiety and worry around whether or not you have the right prescription drug plan, just know that you are not alone. And don't let that anxiety paralyze you into doing nothing, because I'm going to show you step by step how to look at all of the different drug plans available to you, what to look for when you're comparing, and then how to either keep your existing plan or switch to a new one. This video really only applies to those on a standalone Part D plan, so either you have just original Medicare only and a drug plan, or you have original Medicare and a supplement plan, and then a standalone Part D drug plan. Medicare Advantage friends, this video is not geared for you, but you're more than welcome to keep watching if you'd like. Okay, let's head on back over to Medicare.gov, and up at the top there is going to be a Health and Drug Plans dropdown. Open that, and then you're going to see Find Health and Drug Plans. Now, if you have a Medicare.gov account, you can log in here. It will save you some time because it will automatically pull in any medications that you've filled in the last year rather than you having to manually type them in. If you have a lot of medications, this can be a quick, convenient way to get them all in there without having to get up, walk to your medicine cabinet, spell the crazy names, and then figure out the dosages and frequencies. So if you don't have a Medicare.gov account yet, I do recommend signing up for one, but this video is going to show you how to do all of this comparison without needing to log into a Medicare.gov account. Okay, over here on the right, you have your coverage, and it's most likely going to be for 2024. Then you're going to want to put in your zip code. And we're going to be looking at sunny Orlando, Florida, and pretend like we live in Walt Disney World for this tutorial. Click that Continue button. For this, we are looking at Medicare Drug Plans, Part D, and then click Find Plans. The next question is for those with low incomes. So mark whether or not you are getting extra help or financial assistance for medications. So if this applies, mark which program you have. If you don't know, there is an option for you're not sure, or if you know that you are not getting any help, there's an answer for that as well. Now we're going to click the next button. Yes, we do want to see drug costs when we compare plans. Okay, here is where you put in your medications. As you start typing, you'll see options pop up, and then you can pick the medication. If you are typing and you don't see your medication, that means that you're probably spelling it wrong. Less is more here, and I like to start with the first few letters and then pick from the options rather than trying to type out the whole medication name. Make sure that you get the drug name, the type of medication, whether that's a tablet or a capsule or ointment or solution. Make sure you get that right. It can have dramatic swings in price. Same with the quantity and frequency. 30 pills every month is different than 30 pills every 90 days. I'm putting in medications that I know are going to push the costs really high just to show how Part D works. So let's speed through this and don't let some of these numbers scare you. Okay, when you have them all in there, scroll down to the bottom and you're going to click on the Done Adding Drugs button. Now here is where you're going to put in your preferred pharmacies. I recommend that you do at least 3. Even if you have a favorite pharmacy and you know that that's the one that you want to go to, please add 2 others, and you'll see why here in a minute. I'm going to click mail order as an option, and then I'm going to pick 4 more. And this is another thing. When I say add more than one pharmacy, I don't mean add 3 different locations of the same pharmacy. Don't add 3 Walgreens. Pick different chains or different brands of pharmacies altogether. You can also search by the name of the pharmacy right up here. You can change the distance away from where your zip code is here. I'm just going to pick some in this drop-down list. When you have all of those in there, at the bottom on the right, you can click Done. Now you get to see all of the different plans. This is not an endorsement from us to pick any that you see here. I have a random set of medications I use, and this will all change depending on your medications and where you live. So this is not a recommendation for these plans. But in this totally made up case, the next very important thing to do is to make sure that you aren't distracted by just the premium amount. We are looking at the total estimated cost. This is the total out-of-pocket cost that you would be looking at, and it includes your monthly premium and your drug costs, not just the monthly premium amount. So this total drug and premium cost is what we're looking at for all of these plans. I get messages all the time that say, hey, I found a drug plan with a lower monthly premium than the one I'm on now. This is great. But then that plan doesn't cover their medications in the same way that the old plan did. And the total cost of premiums plus drug costs is actually higher for them than on the plan with a higher monthly premium because it covers drugs better. So make sure that this is sorted by drug and premium costs right over here. Now in our case, the lowest overall cost plan also happens to have the lowest premiums. Go figure. Okay, here you can see the premium amount. If we scroll down, here's the premium amount for the next plan. This is the amount that you have to pay just to have the plan. If you have IRMA charges because you have a higher income, you'd add that IRMA surcharge to the premium that you see with the plan that you pick. Here is the deductible or the dollar amount that you need to pay first before your drug plan kicks in. Now you're going to want to click on plan details here. Once you're in plan details, I'm going to show you things to look at. First, you want to click on drug coverage. Okay, here is where you can see if the pharmacies that you picked are in-network. In-network and preferred in-network are two different things. You'll see that here. Notice how in this case, with this plan, we have an in-network pharmacy, an out-of-network pharmacy, and a preferred in-network pharmacy. Actually, a few preferred in-network pharmacies. In general, the drug costs for medications will be lower with preferred in-network pharmacies, but of course, because we are doing a demo, we get to see exceptions where a simple in-network pharmacy actually comes in lower than preferred in-network pharmacies. As you scroll down, you can see which pharmacy has the lowest overall costs for this plan right along here. And you can also see which ones have the lowest general cost for the medications as we go across here by pharmacy. Now we have a deep dive video on our channel that goes over how Part D coverage works, and this is where that video really starts to make a lot more sense. Notice that as you scroll down, it's going to say when you can expect to meet your deductible. With all of these, this is going to be January for the medications that we have. Next, it's going to show when you can expect to move out of initial coverage and go into the coverage gap. The coverage gap is the notorious donut hole. And then finally, what month you can expect to move out of the coverage gap or donut hole and into catastrophic coverage. Keep going down and you can see how much you could expect to pay out of pocket in each and every month depending on the pharmacy that you fill your prescriptions. Notice how there are zeros as you get down to the bottom here. That's because in 2024, we finally have a maximum out of pocket for the first time on Part D prescription drug coverage, and your max out of pocket is as soon as you get through the coverage gap or the donut hole and into catastrophic coverage. All right, the last interesting thing to look at here is you can click on each of the individual pharmacies here, click on these little drop-down pluses, and you can see how the retail cost and the cost before the deductible, cost after the deductible, cost in the coverage gap and cost after the coverage gap prices break down. Notice that some medications with some pharmacies and certain plans have some level of coverage even before you hit the deductible. In this example, most do not, but if you have a lot of low-cost generic medications, those usually have some form of coverage before the deductible on a lot of these plans. And you can see how much they will cost in each phase of Part D coverage. Okay, you can compare up to 3 plans at a time, and one thing to really notice here is if your drugs are covered. In this example, all 6 of the medications are covered. You start to run into issues if you do not have drugs that are covered by a certain plan. Once you are ready, you can click the enroll button and you will be able to enroll in this plan for the upcoming year. If you find that your current plan that you are on right now is the lowest cost plan, you don't need to do anything. Your plan will automatically renew for the next year. You don't have to go through and enroll in it again here. Now, a couple of things to button up here and then I'll let you go. First, if you are working with an agent and you enroll this way, it will remove your agent as your helper for your drug plan. It won't affect you and them with your supplement plan, but it will with the drug plan. Many agents don't help with Part D coverage anyway and will just point you to Medicare.gov and these steps. We do offer assistance with Part D coverage for clients of ours who have their supplement plan through us. This is by no means a knock on any agents that would not help with Part D coverage. It's just the reality of the fact that they're doing something similar to this anyway. So you're able to see exactly what agents see by going through this method. For those of you with agents who do help you with Part D coverage, enrolling through Medicare.gov, again, will remove any commissions that agent was earning by helping you. It doesn't save you money, it just allows the insurance company to keep more of the commissions as profit for themselves rather than send it to the agents. If your agent is helping you with Part D coverage, you could go through all of these steps, not enroll through Medicare.gov, and then tell your agent the plan that Medicare.gov recommended and see if he or she can get you all set up on that plan if you do want to do that for your agent, but you're by no means obligated to do so. Second thing to clear up here, if you are on an Advantage plan and you do this, it will automatically cancel your Advantage plan. So again, this video is not for those on Advantage plans. It is only for those who have some form of a standalone Part D prescription drug plan, either because you have original Medicare only and a drug plan, or because you have a supplement plan and a standalone Part D drug plan. Do not do this if you are on an Advantage plan. With all of the terms that we mentioned in this video, like the deductible phase, the initial coverage phase, the coverage gap or donut hole, and catastrophic coverage phase, we have a video right here that you're definitely going to want to check out. I will see you over there.